Senator Rausch, who represents the Norfolk, Bristol, and Middlesex districts, urged the Baker administration, the Department of Elementary and Secondary Education, and Department of Public Health to require masks indoors for all schools. Over 200 medical professionals also reached out to the administration for a mask mandate which would follow guidance from the CDC and American Academy of Pediatrics. On Friday, July 30th, the state released its fall COVID-19 guidance for districts and schools. There will not be a mask mandate, but it strongly recommends all students in kindergarten through grade 6 wear masks when indoors. We spoke with Senator Rausch for her thoughts on wearing masks in schools.
Particularly with children who are too young to even be eligible for a vaccine, masks remain one of our most important tools in our COVID prevention and mitigation toolbox. We know they're effective. We know they work based on our experiences in schools last year. They are a very low cost, no risk method of making sure that we are doing everything we can to prevent the spread of COVID-19 among children, families, and in our communities. It's also incredibly important that we make sure that everyone age 2 and up in every school setting is wearing a mask to ensure that kids can actually stay in schools this year, to help avoid yet another round of total havoc for parents and businesses trying to figure out how to make it all work with kids home from school, kids in quarantine, schools shut down, and trying to balance, any kind of remote school that may or may not come if those shutdowns occur. We know that a mask optional approach won't work. All you need to do is ask Dr. Walensky, the director of the CDC, as to why a voluntary honor system type approach doesn't work. The fact that we had that kind of honor system approach at the national level is why we're back in this situation now. Masks optional or masks on an honor system dependent on vaccine status not only is unenforceable, but also creates the opportunity for pretty significant bullying and peer pressure, particularly concerningly against the children who may be listening to their parents who are actually following public health protocols and guidelines and safety measures. So we have to have a requirement. It's the only way forward. We know that Delta is transmissible by vaccinated individuals. We also know that the vaccines are working because they are protecting people from serious illness and death. But the Cape, for example, is one of the most highly vaccinated areas of the state. And we still saw a massive outbreak of the Delta variant down in Provincetown, but particularly in school groups where we know that the vast majority of students are not even eligible yet for a vaccine. And we know that the vaccination rates among students in grades 7 through 12 is notably lower than the overall vaccination rate. Just in the month of July, increased over 700%. That is a massive statistic. We know that Delta is stickier. We know that Delta can lead to more severe health implications and ramifications. We know that kids transmit Delta. We know that kids live in multifamily homes and can transmit Delta to other people. We know that remote school is not an option. We know that distancing in schools is also not an option. Masks are the only option we have, particularly in the younger grades. And frankly, our vaccination rates in grades 7 to 12 are insufficient to protect against community spread of COVID. So we need masks in schools. These decisions should be made by the people at the state level who can generate consistency all throughout the state, and the people who have access to some of the leading medical and epidemiological experts in the world. That is the governor. That is the Secretary of Health and Human Services. That is the acting commissioner of the Department of Public Health. That is certainly all of the upper level administrative folks at the Department of Education. This is a statewide issue. COVID doesn't know the district between schools, between districts, between even counties. This is a statewide problem, and it needs and deserves a statewide solution. We need to have a consistent statewide policy that makes it very clear that we are putting the health and safety of children, teachers, school administrators, families, everyone in any way engaged in school communities, which is pretty much all of us. We are putting that health and safety first and foremost.